broadcasting live at Nesha Medical Practice. It's called Nesha Talks. Welcome to the show. This is a platform where we get to chat, where we get to talk and ask questions. Feel free to drop your comments down below. Joined by the expert himself, that's none other than Dr. Nelson Makemba. Welcome.
It's always a great pleasure being here, and I'm excited to be part of this, development, and I'm indeed excited to be informing the nation.
Oh, yes. Yeah. And that's what Nesha does very, very well. Before we still kick off, where is Nesha situated at?
Okay, we are in the heart of Windhoek North. We are just across from Central Hospital main entrance. Our physical address is OEF Street, F209. Just as you come out of Central Hospital main entrance, across the road, we are just in between the dentist and the pharmacist.
Okay. Yeah. It's the beautiful red logo, just in case. Yeah. So, Doc, for this edition, we decided to focus on tuberculosis. And not only just that, but also pulmonary TB. Yeah. So maybe just let's give the broad terminology. What does it mean and the subsections thereof?
Yeah. Tuberculosis, in a nutshell, basically is just, an infection called, by the bacteria, which is a bacilli. Like you have highlighted earlier, today we are talking about pulmonary tuberculosis. But in a nutshell, if one is infected with tuberculosis, it can spread to other part of the body. We have seen individuals, developing TB in the brain, in the spine. It can also go to the stomach and the intestine. So TB in a nutshell can affect any other part of the body. In fact, also in female population, we have seen TB of the breast that often present similar to TB, cancer of the breast. So TB in a nutshell can actually affect other part of the body. But today we are going to focus primarily on pulmonary tuberculosis, which is TB that infect the lungs.
Okay. Yeah. It's like years ago we heard so much about TB prevention. It seems like slowly but surely we're not talking as much about it. How are we paring in terms of on the African continent? Are we curbing it? Is it increasing? Where do we stand at the moment?
I think we have done very well over the years, especially now that you have highlighted to the fact that we're not hearing that much anymore. In fact, Africa, particularly in our setting here in Namibia, we are doing very well when it comes to infectious disease. The country has done very well. There's a lot of good programs in place. I think we are probably one of the best performing, African nation in terms of, addressing aspects of tuberculosis. Also, particularly because TB and HIV often go well in hand together. When one infected with the other, they are likely to end up with the other one. But our country has done very well. That's why you don't really see a lot that is said about the topic. But nevertheless, it still exists, and this is the reason I want to just, inform those that are engaging us today on this subject matter.
Great. So let's dive in. Pulmonary. Let's first look at the symptoms and the signs. If someone may have that.
Okay. If an individual has picked up pulmonary tuberculosis, how they end up presenting often is they got a cough that is persistent. Oftentimes, the history of coughing might go as far as 4 weeks, which is a duration of an entire month. They also tend to present with weight loss for no reason. They are not dieting, not exercising, but they just continuously loses weight. They got excessive night sweat, literally drenching sweats at night. You wake up with a wet pillow, wet beddings. They might have loss of appetite. They might have what we often refer to as a pleuritic chest pain. In other words, the chest is painful when they are coughing. They got this weakness, they got malaise, the joints are paining. They might have actually loss of appetite. These are but some of the cardinal features, and oftentimes they have what we call a productive cough. In other words, when they are coughing, this mucus coming up is often thick yellow mucus that they are actually expectorating when they are coughing it up. And once they have this kind of clinical picture, there's a likelihood that we are looking at an individual that might be struggling or infected with pulmonary tuberculosis.
So, who is more prone to picking this up?
Individuals that are infected with HIV and AIDS, those ones, because the immune system tend to sort of get a knock and they become weakened, they might be at an increased risk of developing pulmonary tuberculosis. Other immunocompromising illness such as cancer, diabetes, kidney failure, the frails and the vulnerable, the extremes of age, too old, too young, being in a presence or in close contact with somebody that is infected with pulmonary tuberculosis, living under the same roof, for instance, and if the person is continually coughing the bacillus in the air and they are not on treatment, that increases, one's risk of developing, pulmonary and contracting the bacilli that, lead to, the infection of pulmonary tuberculosis. Because when somebody cough, they cough it up in the air, and then when you breathe the air in, you breathe those, bacteria in. That's why ventilation is also very important in the environment where an individual finds themselves is poorly ventilated.
Yeah.
That then becomes an increased, risk, to developing that. Individual also in hostel settings, such as children that are in boarding school. If one child pick it up and is always coughing in the boarding school, there's a likelihood that they can pass it on to others.
So it is contagious.
It is contagious, yeah. And also historically, when people used to work in mining sectors, they used to live in compounds, in this cluster. I think we have done very well with that kind of setup. People are now, able to live, in their own individual homes. Those kind of, old age home as well. If, one turning in an old age home, pick it up, and maybe it's not picked up on time and she's coughing and interacting with others, she can also, or he can also pass it on to others. So, individuals that often find themselves in close clustered, setup, they also have an increased risk of contracting it should an individual within the setup get it.
All right. So, Doc, if someone goes through all those symptoms that you mentioned, like, the coughing and the sweating, what does someone do and how quickly should they go? Not only after the 4 weeks, obviously.
Yeah. If you have a rather worrisome cough and you are sweating at night and you are losing weight, at least those three, those are probably cardinal features to suggest that you need to get yourself checked out. What you then need to do is to go to your doctor, if you do have one, go to the clinic nearby you or health facility. Basic test that we do is basically, taking the sputum sample, especially if you are coughing and there's something coming out. We would want to harvest the sample in the morning when you wake up, before you even brush your teeth. So you might find that if you go to a doctor, you might be given a bottle to take with home, and the instruction will be tomorrow, the first thing that you do when you get up in the morning, that first cough that comes out before you even brush your teeth, put it in this bottle, seal it, and then we take it to the laboratory.
So you cough in the bottle?
You cough in that little specimen container. Then we send that to the laboratory for further evaluation. In our setting, particularly here in Africa, we have managed quite a number of cases with TB. It's actually easy to pick it up on a chest X-ray as well. If you get sent to do a chest X-ray, if you have a seasoned, experienced clinician that has treated a number of patients with TB, just looking at the X-ray, you might be able to pick it up as well. So those are the two, mainstay investigative tool that we have at our disposal that we can use to come up with a conclusion that there is definitely a problem of pulmonary tuberculosis going on, and then going further we can then manage the patient.
And if somebody has been diagnosed, what's the process, Doc? Is there medication? Do you have to go through some, treatment for how long? What's the whole process?
Yeah, we have a protocol that sort of guides us in managing problems of this nature. We have what we call an intensive phase, and a continuation phase. The intensive phase is basically the first 2 months when you have been handed down the diagnosis. We put you on medications, and then we take off 2, and then we continue with the rest for the next 4 months. That gives us a duration of 6 months, really. We might run into trouble once in a while where you might have a resistant type of a TB. And why do people develop resistant type of a TB? Number one, it could have been an individual that was diagnosed with TB, put on treatment, and they didn't take their medication as prescribed. So the bug then becomes a bit smart and start to resist. So when you develop the resistant type of a picture, we might actually extend your period of treatment. There might be an injection that might be added to your treatment that you have to go in the facility and get injected. And because of the side effect of the medication, sometimes they can cause what we call peripheral neuropathy, where they can affect your nerves, where you might have this tingling sensation in the nerve. We also give you an extra medication to sort of, counter that so that you don't end up with those kind of complications. Because if that happens, that might discourage the individual from continuing the medication, which is not good. Because then if you don't complete the course, we might not be able to eradicate the infection properly. That's when it starts spreading to other part of the body, as I highlighted to earlier. It might go to the brain, then you got those tuberculomas, those lumps that developed in the brain. It might go to your spine as well, causing those deformities, the kyphoid deformities. It might go to your stomach as well. We have seen people that unfortunately were not careful to take their medication properly, developing that kind of complications. And oftentimes when the complications set in, it becomes very difficult to treat, and it might actually lead to us losing a patient. Yeah.
So it is life-threatening disease.
It can be.
And what's the percentage of those that actually die because of this?
Most of the people that will probably die from tuberculosis are either those that have not been diagnosed on time. So by the time they present to the facility, they are really very sick, and all other complications might have set in. Those that do not take their medication as prescribed, or those that have comorbid disorder. In other words, they have picked up TB, but then they got other problems. So, it then become a compound effect. All that take a toll on their body, and unfortunately, sometimes they are not able to come out of it. But as we have highlighted to earlier, from the beginning of our conversation, is our country particularly, I must, highlight, we have done very well, especially in the fight of infectious diseases. We are doing very well. And I think we were able to combat, and, sort of, bring most of these problems, under control.
So it's safe to say, Doc, that it's curable and treatable.
It's curable.
If you're on that 6-month path.
Yeah, if you get, to have the diagnosis handed down on time.
Yeah.
Medication initiated on time. And if you take your medication accordingly, you are in a place where you're able to do much, much, much better, So the idea really then is to just make sure that we encourage those that have been diagnosed with pulmonary tuberculosis to make sure they take their medication as prescribed.
Can it reoccur if you've, been treated?
It has been demonstrated in a few cases where recurrence can take place, especially depending on the circumstances. If somebody, for instance, is in a setting that is not well resourced, for instance, poor socioeconomic background, individuals become malnourished, maybe they are not eating properly, and that also tend to weaken the immune system. They pick up a diabetes along the line, or maybe some sort of cancer, and they go on treatment. That can then have a knock on their body, and if they get exposed to somebody that is coughing, that might be having TB, they can actually, get reinfected.
All right, Doc, thank you very much for your knowledge and your experience. We appreciate it, and all the best. Next month, we'll be back again.
It's always a pleasure talking to you, and thank you for, those that are engaging us, can continue watching.
For sure. Not only just watching, but become active as well. Drop your comments, your questions on the feed as well, and share and subscribe to get the notification for next month's edition. Thank you for joining.